right, so we have Alexa that flew all the way out here from Arizona because things just weren't working out the way that she really needed them to. So Alexa, you want to kind of share your journey that you just came from, and it started about 6 months ago, right?
Yeah, about 6 months ago.
Yeah.
So about 6 months ago, I was playing pickleball. Go figure that I get an injury from pickleball.
Shocker.
Yeah, came on the left side, and then eventually just was my entire lower spine near the pelvis, and so I've been having this constant, not excruciating, dull pain for about 6 months. In December, and I've been going to a chiropractor at the Joint Chiropractic in Arizona for probably 9 months now.
How many times a week were you going?
Once a week.
Once a week, okay.
Yeah, once a week, all for maintenance. And
how did that work though? Because your symptoms continued, right?
yeah,
Did they get either better or worse?
Nothing.
Yeah.
No, and the technique that they were using, just again, I knew that it wasn't what I needed, and so then I fast forward to December, still having the issues. Went to the ER, got an X-ray because I'm like, what if it's something worse?
Right.
And so did that. Went on a steroid pack for a week. It got marginally better, but still, it was still there, still dull chronic pain. So then I went to a pain management place, and they also did X-rays. So both of them did X-rays. They're like, there's nothing on the X-rays. You're perfectly fine.
But the chiropractor didn't take any X-rays.
No X-rays from the chiropractor, 2 rounds of X-rays from the ER doctor and the pain management doctor.
Question, did they take X-rays of your pelvis, or did they take just X-rays of your low back?
The pelvis.
Oh, so they actually included the pelvis.
Yeah.
Okay, interesting.
Yeah.
Okay, that's actually good.
Okay.
Yeah.
Yeah, but not good enough.
Well, but they didn't know what to do with it, right?
Sure.
Because they said, what did they tell you?
That it looked fine. There
That
wasn't
looked fine,
anything,
right.
Any issues.
Yeah.
Yeah, so then I did the second round of steroids. Again, it's definitely gone from, let's say, 70% to now 85%, but I had already scheduled to come see you.
Yeah.
And so, we have it lined up. We did X-rays. We just did my first adjustment in a while.
Mhm.
We'll have 2 more next week, and I started crying on the table because I just instant relief. So.
Yeah, and the other thing, well, that's what we do. I
Yeah.
can't, listen, I like to say this one thing for sure. Failure is never an option. It's not an option. Worked in strongman for a long time, middle of competitions. Failure's not an option there. And so, with almost 30 years in that and almost 30 years in doing, complex chiropractic applications and then melding the two into a technique, it's something that, for me, I've developed an education program, and I know, while we were discussing it, it was one of those things, a dream of yours is that somebody will learn this technique near you. And,
Yes.
the thing is, it requires time, to get good at anything, whether you're a chef or a mechanic at a garage or, a janitor, it doesn't matter. Sometimes it takes a while to get good at anything. But what we're finding is we're just finding a lot of people who are shortcutting things so badly that it becomes a situation where there's a huge lack of data. And what did you learn about your pelvis today? Now, you had previous X-rays on pelvic and low back, but did anybody point out the things that we saw, and how obvious was it to you once I pointed it out to you?
Oh, extremely obvious.
Right.
Yeah, it's just disappointing to see all of these professionals and they're bringing their expertise to the client, the person who's needing help, and it's just inferior. So.
Yeah, they're falling, a lot of people, they're falling short. And, for me in chiropractic, I just want chiropractic to be better.
Yeah.
But unfortunately within the chiropractic profession, it's like, well, you're just being critical because. It's really not about me. It's about my friends. It's about you. It's about trying to make chiropractic better. And that is the mission. That's always been the mission. I actually almost worked myself out of a job because, as we were talking, many young chiropractors will see anywhere from 3 to 5 times a week to try and get some resolution. But what we're finding is like we've got people that are spending, maybe $4,500 on a wide variety of different applications, and the applications are falling short as far as reduction of symptoms. End result is your $45,000 or $100 lighter in your pocketbook, but you still have, 60 to 80% of the symptoms that you started with, only to find once the data is collected here, assimilated, and then a process executed with a surgical precise, if you will, adjustment, and you're 95% better instantaneously, or in your case, completely pain free.
Yeah.
And so what's that worth? One adjustment now is worth 6 months of pain, worth $4,500 in cash. So I'm working my way out of a job while everybody else is making money doing what to your words, inferior work. How sad is that? So where's the happy spot? That's the thing. Where's the happy spot? For you, your happy spot is when you feel better, right?
I'm just waiting for him to say something else.
I'm like that,
We're being appropriate right now.
I know, right? Hey, we keep it real. We have fun while we're trying to make it, trudge our way through difficult times. Mm-hmm. And, I had to learn that. I almost lost an arm back in 1988. I've had to have a sense of humor. And when you are feeling bad, it's like, hey, how about a little distraction? And humor is always the best medicine. One of my favorite movies is Patch Adams. You ever seen that movie? Love that movie. So if you haven't seen Patch Adams, look it up. It's a great movie. So
it describes Dr. Todd completely.
Yeah, right. I even have the rubber nose in the other room. So anyway, just for fun. My feet are just naturally big, so I don't need to wear pants on those. With that, yuck. Anyway, as a whole, there's a couple things. One, what would you tell other chiropractors that are out there who are looking to learn something that will really, if they truly want to make an impact on the patients, what would you tell those doctors?
I would tell them to invest some time, money, and effort into your technique, because it is and I've gone to many chiropractors throughout my life, and I fucking flew here. Sorry. I flew here.
That's right.
To come get
it's
adjusted.
Emotional, right?
It is, yeah.
It is emotional.
Especially when it's again, I've been going to a chiropractor weekly for 9 months now, and I can come to you in one adjustment, and you can see all of the ailments, you can see all the misalignments, and then you can immediately put them back into place. I mean, it's just phenomenal.
And as far as those people out there, and this is the second portion of it, those people who are skeptical because they've gone to doctors like you've gone to, and listen, it's okay. I mean, there's what I call soccer mom chiropractors all over the place, and it's fine. I mean, I'm not taking away from them. But when you're in trouble and there's a little bit of complexity, those people, what would you say to them about, don't give up, maybe?
I like it.
Yeah. I mean, we could be that solution.
Yeah, you can, where there's a will, there's a way, and there are people who are there to help you.
Yeah.
Like Todd McDougall, Dr. Todd McDougall.
Well, yeah, right? Yes. So if as a whole, I'd ask her to do this because we're obviously very comfortable. But if you're on the struggle bus, whether you're surgical, pre-surgical, post-surgical, scoliosis, you're an athlete in trouble, you've been concussed, your jaw is messed up, neck pain, weird sensations in your arms or down your legs. We have a solution here that's been created with the interesting merger, if you will, of sports chiropractic and complex chiropractic applications. We may be that solution. No, we're not free. No, we're not insurance. But if you're really serious about wanting to get better, I think we might have something for you. And we'd love to give it a try. So call Gretchen and let's see what we can do. Any last couple words?
It's in chiropractic, so look it up.
inchiropractic.com.
There you go.
And call Gretchen.
Yep,
Don't
call
suffer
me.
anymore. Yes, see? From the back. So thanks so much for watching.